Hi, everybody. Today we are here answering the question, how to make care and patient decisions you won't regret. Caregivers make a lot of day-to-day, short, and long-term decisions. The people who need care, that the healthcare system likes to call patients, have a lot of decisions to make about health, well-being, daily activities, and treatments. And it's easy to have what is called decisional regret when we look back at a decision that we made and think, oh my gosh, did I make the right decision? Or I did make the right decision. So what steps can you make to have care and patient decisions come out the way that you want so that you don't regret them? Stay with me while I share 10 practical tips plus information that you must seek from healthcare providers to allow you to avoid this decision regret when you make care and patient decisions. A lot of these tips can apply to other decisions that you might have to make in life. I'll also share a story about a particular care situation and give you questions that you can ask yourself about all of these decision-making processes. I'm Pamela D Wilson. I'm a caregiving expert, advocate, and speaker with more than 20 years of experience. Please click below, like this video, follow my channel, and please comment, even if just to say, hey, thanks for the video, so that other people who are seeking the same information, hope, and help can find their way here. Your comments, your participation makes a big difference for other people. You can also visit my website, PamelaDWilson.com, where you will find 3 programs: How to Care for Aging Parents, Insights into Appointing or Being an Agent Under Power of Attorney, and a course about guardianship. The links are below. So, number 1, for how to make care and patient decisions you won't regret might seem obvious, but it's important to know everything about the choice that you have to make and the consequences of the choice or the choices. Now, the simplest way to explain this is to point you to the television and to go a little deeper. So how many of you see all of these pharmaceutical company commercials for medicines promising a better life? If you have this pill is the answer to everything, right? You see happy people spending time with their family, doing pleasant activities in these commercials, and then all of a sudden there's this voice speaking at the speed of light with all of these warnings. Don't take this medication if the side effects include, you might experience this. That 30-second commercial provides a lot of details that probably go way over your head because you're so focused on looking at these happy people living their best life that you don't hear about all the other really important stuff. So, if you are a caregiver or a patient, you might know that taking medicine alone does not solve all of your health problems that you might be experiencing. So I want to look at a care example of a person who was diagnosed with what I'm calling early stage. So early stage is stage 1 to 3 cancer. Could be breast cancer, it could be colon cancer, any kind of cancer. Because breast and colon cancer really are 2 of the most common cancers that people are coming down with these days. And we're going to look at the choice to pursue treatment or to not pursue treatment as an example of the topic of this video. Now, if you are a caregiver or a person who doesn't have cancer, don't click away because it's important to see this decision-making process that applies to every single diagnosis. I'm just using cancer as one example. Now, I also want to give a little disclaimer and get into the weeds a little bit so that I don't receive a lot of comments below about advanced cancer, which is stage 4, that's spread to multiple body parts. So this example that I'm going to give you, I'm purposely talking about earlier stage cancer, where the cancer is localized maybe to one body part and has not spread to any other organs. Another example of this could be something as simple as skin cancer. You have a spot on your hand or your face that you need to have removed, right? So my purpose in sharing this limitation on cancer is that there's going to be an associated podcast and a transcript to accompany this video coming up in a couple of weeks. I'll put the link below when it's available. But there are going to be a lot of research articles about the benefits of treatment and therapies and decision making and the types of decisions that you'll have to make, and a lot of factual information that you can look at, because as you know, I always give the pros and cons, but I really do rely on research and facts rather than emotion, because emotion can really take us off track when we're making decisions. So, specific to cancer and early treatment, there's a word called adjuvant, A-D-J-U-V-A-N-T, and what it means is it means optional cancer treatments before or after this primary diagnosis to treat the cancer. So for example, people who have breast cancer may have chemotherapy and radiation first and then have a breast removed. People who have colon cancer may have the colon cancer removed and then have treatment after. It just really depends on the options that your doctor provides, your own individual health situation. No right or wrong way. It's done both ways. But you have to know that this is an optional choice, right? Because technically, they have removed the cancer from your body. It's not there anymore. But the cancer can still be circulating in your blood system. It can be in another organ that is not yet visible on any blood tests or any scans, which, if you have cancer, is pretty scary. So in response to number one, which is know the choice that you have to make and the consequences of that choice, whether it's cancer or any other diagnosis, the answer is to be thorough. So how do you do that? Well, so for example, a physician will normally cite percentages, right? So let's say that you have a choice to have cancer surgery and treatment after. The surgeon could say, well, if we remove this cancer from your hand or your colon or your breast or prostate, anywhere, right? If we remove it, you have a X chance of long-term survival. If we remove it and you agree to treatment after, which could be chemotherapy and radiation, then you have an X chance of survival. Now, more than likely, that percentage, if you have additional treatment, is going to be higher. And so I'm going to throw out some numbers which are not research, not anything, but let's say that you have a 50% chance of surviving if you have this particular cancer surgery. And if you get the treatment after the cancer surgery, then you have a 90% of long-term survival. So if you're looking at numbers only, what would you rather have? 50% or 90%, right? So there's a choice to make there. But because cancer and other treatments can really be a numbers game, you have to decide if you want to have this better long-term chance of recovery by doing these other things. Now, there's thousands, millions of stories out there about cancer and other survivors of serious illnesses. So on the choice side, you have to decide which side you want to be based on statistics, but there are other considerations, which takes us to number two. Specific to the choices is to understand the demands and the effects of the treatment. So for cancer, the treatments are usually chemotherapy and radiation. Understanding the demands of the treatment means understanding, what does chemotherapy mean? What does it do? What does radiation mean? What does it do? Chemotherapy can be through an infusion, which is a fluid that goes into the veins. It can be oral through medications that you take. It can be a combination of both. Then you've got radiation therapy. So as you're looking at all of these choices of, do I do this? Do I not do this? Do I wait? It's important to take and make the time to be very, very thorough, to understand the demands of the treatment. And by this, what I mean is, how often do you have to go to that doctor's office? Is it once a week? Is it every 3 weeks? Is it every 6 weeks? How long, if you're having treatment, will that be? Is it an entire day? Is it 4 hours? How are you going to feel after that treatment? Meaning, what are the side effects of this medication or treatment? Then, if I'm having treatment for this, how does that interact with any other health conditions that I might have, or any other medications I might take, or any supplements I might take? There's a long list of questions that I will include on the website page that will accompany this video in about 2 weeks. So the challenges to getting all this information right is that you can be overwhelmed. But the other challenge is, you are given at most, if you're lucky, a 15 or 20-minute doctor appointment. So it's important to know that the information that you get at this appointment is the minimum amount of information that has to be provided to help you make this decision. Now, everybody's different, depending on your health condition and a lot of other factors, right? This limited amount of information may not be all of the information that you need. So what happens? You all know this, right? We all go searching on the internet. My recommendation, as always, if you're going to do this, is to search for research studies and research articles that address your specific question. You can literally, honestly, go down a rabbit hole and spend hours, days, weeks on the internet searching for this information. The downside is you might come out more confused or more frightened than you were in the first place. So other reputable places to go are like the Mayo Clinic website, the Cleveland Clinic website. Again, they have a lot of research and validated information there. Now, another option, probably a better option, is to see if there is a nurse or a social worker or a pharmacist or another person who is associated with your doctor's office or the health care center that you go to who can answer your questions. Getting direct answers is always better, but even still, you have to recognize if these people have not been through the treatment, they're giving you information based on general information for a lot of people, and you may be that one unique person who's going to have this unusual side effect. So, depending on the extent of the treatment, dialysis, people who receive dialysis, that's another one that really requires a lot of thorough evaluation because once you start that, stopping it has life-ending effects, okay? So depending on the diagnosis and the extent and the treatment, you may want to spend time researching this and looking at all of the options if the doctor confirms that, waiting a week or 2 weeks or 3 weeks or 4 weeks is not going to make that much of a difference for your condition. So you want to take the time to make sure that you evaluate all of this. Number 3, for how to make care and patient decisions you will not regret, is to not let fear get the best of you. It's easy to have this runaway mind, right, where we're thinking of all these horrible things that can happen with a new health diagnosis or treatment, and we're scared to death because we've heard horror stories of other people. Again, your goal is to become as informed and knowledgeable as possible, whatever it takes, so that you can make the best choice, knowing as much about the consequences as possible. So let's say that you're choosing to take this time to think about a decision. Okay, here's some other questions to ask yourself. Who else will you want to discuss this diagnosis or treatment decision with, in addition to the doctor who's giving you the diagnosis? Do you need to see a surgeon to learn about the process and the effects and the recovery from surgery? Or if you have cancer, do you need to see an oncologist? If you're considering dialysis, do you need to consult a nephrologist? If you've been diagnosed with type 1 diabetes, do you need to go see an endocrinologist? Or, visit a cancer center or a dialysis center to see what those look like? Or do you need to consult with one of your current medical specialists if you have cardiovascular or heart issues? Being thorough and going step by step and being very, very methodical is the best way that you have to eliminate this possibility of saying, oh my gosh, nobody told me that. Why didn't I ask this question? How could I have, oh my gosh, missed that, right? We want to help you avoid that. Number 4, for how to make care and patient decisions you will not regret, is to look at how you make decisions, right? Are you a person who hears information or seeks information and the first thing that sounds good, you just choose that, right? That comes to you and you do it. Or are you the person, on the other hand, that researches everything and you're making comparisons and you're trying to find out what is the best option for you? Now, on the other hand, are you a person who tends to avoid decision making because you've made mistakes in the past? And decision making is now scary because you don't want to make another mistake. You don't want to make a wrong decision. So instead, you just put it off and you don't do anything. And you wait until disaster strikes and you're forced to make a decision. Or do you worry about making a decision because you think other people are going to second guess you or tell you that you made the wrong decision, or you feel judged by other people? There's a lot of reasons why decision making is very, very complicated. So look at how you've made difficult decisions in the past, the path that you took to do that, how it worked out, positive or negative. Did you discuss your decision with a spouse or in your family or with a best friend? Are you the person who just makes a decision and you never look back? You just keep going forward. Or are you a person who every time you make a decision, you're second guessing, you're thinking, oh, I should have looked for more information. I should have done this. I should have done that. Okay. The more serious the decision, the more time you may need to think and investigate and work through the process. But again, don't take forever. Learn, ask your doctor about the time sensitivity of this decision so that you don't take too much time, which can impact the outcome of your decision and whether it works out or whether it doesn't work out. Very simple example of this. So let's just look at routine things we do or should do, right? Preventative health, mammograms, colonoscopies, blood work, right? If you're a busy caregiver or a busy person and you skip a doctor appointment or you delay any of these treatments and then you're diagnosed with something, you've got a lot more to work through than if you would have just done it on schedule and caught it earlier, right? So number 4, for how to make care and patient decisions you will not regret, is to understand the options and really the effect of doing nothing, which some people choose to do. They want to be that 50% instead of the 90% because they're scared of all the stuff that it's going to take to get to that 90%. And it can be a lot. So let's say that you decide against the treatment. Make sure that you understand the short-term and long-term effects of that decision, right? Because what happens if 6 months from now you're miserably sick and you're thinking, oh my gosh, I should have done that treatment. I am so miserable. Can you now go back and request treatment? Will your doctor treat you? In some cases, this may be possible. In other cases, it may be too late. Number 5, for how to make care and patient decisions you will not regret, is to ask yourself, what might cause me to regret the decision I make? Now, this can be a difficult question to answer if you haven't gone through and analyzed all the information you need and gotten answers to your questions, right? Or some little bit of information was left out or not mentioned. So in typical research studies, here's how it goes. The healthier a person is before a diagnosis, the better able they are to cope with the physical and mental demands of the diagnosis and the treatment. Because any diagnosis, it doesn't matter whether it's high blood pressure or high cholesterol or diabetes. There are physical and mental demands, and you've got to be prepared for that. And so let me share the story of what happened in my family. I'm going to share the story of my mother. So if you've heard this before, I apologize. But I want to prevent this from happening in your family, right? My mother had so many health conditions from a young age, from her 20s and 30s all the way up until she died at age 69, which is young, right? So many health conditions, heart disease, osteoporosis, continually broken bones, wrists, ankles, name it, many strokes. She also had an aneurysm, which is a weak vein, and a lot of pain from health treatments. She had heart bypass surgery, and at the time, they were not testing blood, so she got a blood transfusion that resulted in hepatitis, which is a liver disease. Now, she smoked cigarettes, pack a day for a long, long time. And she was eventually diagnosed with bladder cancer related to the cigarette smoking. Now, I was in my 20s at the time. All of this health stuff was happening, right? And I had a sister who was a nurse who worked in a hospital, another sister and two brothers. Now, back then, I did not have all the knowledge I had today. If I would have, it would have been a totally different situation. But as children, we were not really involved in, my mom going to the doctor and the treatment discussions and all of that. And so at the time this bladder cancer came up, my mom just decided she was going to have the surgery. Now, what I don't know and never got the chance to talk to her about, because she died, was whether she felt that she had no choice but to do this surgery, whether she wanted to go through with it, or whether they explained what the other options were if she didn't go through with the surgery, right? So surgery happens. They took out her bladder, removed other internal organs or parts of organs where that cancer had spread, right? So before the surgery, she was not a healthy person. A lot of health problems, right? Physically weak, tired all the time. She would sit in a recliner chair all day watching television, occasionally get up to do stuff. Because of the bypass surgery, she had a lot of pain in her legs, so walking hurt. And the hepatitis seriously affected her liver to the degree that she was starting to turn yellow, right? Jaundiced. So in retrospect, the better choice versus surgery for my mother would have been palliative care and hospice care so that she could have lived whatever time she had left with some quality of life. But she chose surgery. So what happened is that she had the surgery. She came home from the hospital, directly home, because she did not want to go to rehab or a nursing home because she thought they were horrible places. And my father and my brother were going to be her caregivers. So as a result of being not physically well before the surgery and exhausted and in just amazing amounts of pain after the surgery, all she did was lay in bed. And over a period of a few days, she acquired a very serious infection called sepsis, and she died. Now, my father and my older brother, who were very dedicated caregivers at the time, I'm sure they were not well informed about things like, what do you watch out for? How do you know if she has an infection? How do you know if you need to call the doctor's office? All of that kind of stuff. Those are things that we're going to talk about more, about being prepared for after surgery or after treatment. What are the things that you need to know and prepare for and ask your doctor about? So my family is a classic example of having somebody who had medical experience, a nurse, right? And still we went through all this. We did not have a well thought out process for what my mother would need after the surgery, how we would care for her, how she would recover, the degree to which she could recover. And so I'm sharing this with you so that you realize the importance of all of these decisions and thought processes, and really also so your family does not have a similar experience as mine. So number 6, for how to make care and patient decisions you will not regret, is to understand this ongoing day-to-day effect of the treatment. So if you understand the typical journey of a patient through a similar process, how will your life change? A great way to learn about this is to get into a caregiver and a patient support group, where you can ask other people to say, hey, anybody here have diabetes? What's your day-to-day life like? Anybody here have breast cancer? Or are you on dialysis? Or have you had colon cancer? Or, a million other things, right? How do you cope with this? How did your life change, right? It's good to hear it from other people who have experienced it, because sometimes your doctors and your nurses and the people in that office have not gone through this, right? They're sharing information with you that may or may not be totally applicable to your situation. Other questions. Are you going to need to look at different habits or put different routines in place? Are you going to need to take time off work? What will the effect of the care that you need be on other people who will care for you, and are they even available? So having any type of a health diagnosis and needing help or support from others, that's just normal, right? It's usual. However, if you're going to have something serious done, it's really important to have this discussion of who's going to help me, who can I pick up the phone and call, what can I ask you to do, how often can you help, how much time can you commit. Have that discussion before this event, right? So that there's no surprises and you got a plan in place. So what people in the healthcare profession like to call this is care planning, right? Or in the event of after surgery and going home or going to rehab and going home, it's post-discharge planning or post-discharge care planning. So this is a topic that you should discuss with your doctor or somebody in their office so that they can provide additional information. You know, things like how soon and how frequently will you need to see the doctor? How long is the recovery period? Am I going to be fine in a week, or is it going to take 4 weeks or 2 months? How quickly can I resume normal activities? What should I expect to feel like? All extremely, extremely important questions. Number 7, for how to make care and patient decisions you will not regret, is to understand what's going on up here for you, okay? Your perception of what you believe about your health if you are the patient, right? And if you're the caregiver, same thing. How is this perception or thoughts or your mental attitude, your mindset, going to affect your response to the surgery or the treatment or the doctor's recommendations? Are you going to be like, yeah, I'm 100% in, I'm going to do whatever it takes, or I don't know about this. I'm worried about the effects. I don't know how I'm going to feel. So again, going back to an example, if you're healthy and you exercise and you don't have a lot of symptoms, are you going to push yourself after surgery to resume your normal workout routine as soon as possible? Because even if you're healthy, it may require that you say, you know what, I am so tired today, but I'm going to go work out anyway, even if it's only for 20 minutes. I'm going to do it. Or are you going to be more fear-based and have all these worries that are going to result in you becoming inactive and doing less, right? Some people have such a fear of going back to the hospital or having something else become wrong, right? That they do as little as possible. It's kind of like shrink wrapping yourself in bubble wrap and thinking that if I do this and I don't move and I don't do anything right, I'm going to be okay. Probably not. Regaining your previous activity level and then pushing yourself to do a little bit more is really the best thing that you can do to care for yourself, as long as the doctor agrees on the plan and you're not hurting yourself. So accommodating any restrictions or pain or anything, right? You want to do this safely. So being totally honest, after surgery, it can be really hard to push yourself to do anything except lay in that bed, especially if you don't feel well. Same thing after chemotherapy or radiation treatments when you don't feel well. Sometimes the cure makes you sick temporarily. And so you almost have to get through the mindset of, you know what, I feel really good now. I'm going to go through a period where I'm not going to feel good for 2 months or 4 months or 6 months. And that really is going to be the pits. But I'm going to get through it because I know there's a light at the end of that tunnel. There's a rainbow at the end where everything I'm going to do, I have this percentage of a chance that I'm going to be better, that this condition is not going to return, right? Got to have a sense of belief. So go back to the other direction, right? If you believe yourself to be in poor health and you're worried about your ability to recover, and you're not getting up out of bed and you're not getting up out of that chair, what do you think is going to happen? Worry is like poison for your mind, right? You've got to believe, you have to push yourself no matter how hard it is to do that if you want to recover. Number 8, for how to make care and patient decisions you will not regret, is to do as much as possible to make it easy for you to take care of yourself, knowing the risk, the pros, and the cons of treatment. So for example, let's say that you have a surgery date scheduled, right? What can you do before? Can you clean your house? Can you make sure that you have all the medications you're going to need after surgery filled and at your house? Can you go grocery shopping? Can you make a bunch of meals and freeze them so that if you don't feel like cooking one day, you take something you made out of the freezer, throw it in the microwave, and you are good. Then Depending on your treatment, again, if there are side effects that you know about, like stomach upset, or you're going to be nauseated or something else, what can you do or have on hand to make you feel better? Do you need saltine crackers or graham crackers or something else, right? The idea is to be prepared as possible for the possibilities and unexpected situations that you might experience. If you live alone, again, who can be available to help you? Who can you call? If you have pets and you can't take care of them, do you need to board them? Do you need to have them go to somebody else's house for a couple of weeks? Other examples, so people who go through chemotherapy, a lot of side effects. They lose their appetites, they don't want to eat. Maybe eating makes them feel nauseated. They can get mouth sores, all types of skin conditions. I mean, honestly, the side effects it's a long list, right? So having a plan to deal with potential side effects is a good plan. It's also important to know if there's somebody at your doctor's office that you can call after hours to say, you know what, I'm experiencing this. Is this normal? Should I be worried? Do I need to go to the hospital? What should I do? So to have like some backup medical person that you can call in your doctor's office. So it's important. Think of all of the things that can and might happen. You're going to hope for the absolute best, but you're also going to be prepared just in case things don't work out the way that you expect. So you're not going to be scrambling or saying, oh my gosh, I should have done these 10 things and I didn't do them. And now I'm here and there's nobody to help me and I'm starving and I feel sick and on and on and on, right? Prepare in advance. Number 9, for how to make care and patient decisions you will not regret is to realize, as we kind of talked about in number 8, right? Your outcome, your progress, your survival is both physical and it's mental. So as we talked, if you're in really good physical condition, you're probably going to have a more easy recovery. Not that it's not going to be difficult, right? But you're going to recover better than somebody who is not in good health. So the attitude that you have to get up here, right, is to be willing to do whatever it takes, no matter how difficult, no matter how long it takes, keep going. And to do this, you need a positive mindset. So again, with the idea of preparing for the after treatment, after surgery, after whatever, what can you do to maintain a positive mindset? Do you have a book that you're going to read? Are you going to listen to music? Are you going to write down some affirmations like, you know, my body is healing every day. I feel better every day. What are you going to do every day to make it through those difficult times when your mind is saying, I don't want to get out of bed today. I don't feel good. I can't do this. I don't like this. I hate this. How I made the wrong decision, right? From a mental perspective, receiving any type of diagnosis can be a shock. It doesn't matter if it's high cholesterol or high blood pressure, right? Your mind might be spinning for days and weeks. So in all of this, you have to set worry time and a worry time frame and be adamant about changing worry and all these negative thoughts to positive thoughts of healing and good times and hope and love and everything. Your mindset, in addition to your physical abilities and your physical health, have a huge impact on your ability to recover and return to life as normal. If you believe you can and you work at it, you are more likely to succeed. Where if you don't believe you can and you're not taking positive steps, it's going to be really harder for you to regain your level of health and your level of strength. So believe in yourself, find ways to establish positive mindsets and positive activities every single day. Do it the first thing when you get up in the morning. Do it again right before you go to bed. So you want to begin and end your day on a really positive note. The last one, number 10, for how to make care and patient decisions you will not regret, is to advocate for yourself. I talk about advocacy all the time. This one may be a repeat that you're hearing from me, but honestly, health professionals are time limited and they are extremely stressed out and pressured. So do not allow poor or missed communication. Do not allow feeling like you don't have enough information to make a decision. Or maybe you got some misinformation or some wrong information that you need to validate. Don't allow any of that or time pressures to make you make a decision that you don't feel is right, or to agree to a treatment, or to do anything that you're not as sure about as possible. I don't know if we ever get to 100% certainty on anything, right, when it's so serious, but you want to be up in those higher percentages, right? There's only one you. There's only one mom or dad or brother or sister or spouse, right? Only one patient. Getting the care you need from the healthcare system can feel like a lot of work and a lot of effort. And it is if you have a serious condition. It can feel like a battle. You can feel like, oh my gosh, I made it to the top of the mountain today, and oh my gosh, there's 7 more mountains there that I have to go through. I have to argue with the insurance company. My prescription didn't come through on time. Somebody lost the test results that I just had done, and I don't want to go back and have it done again. All kinds of stuff happens, right? Nothing in life is perfect. We're not perfect. Patients are not perfect. Caregivers are not perfect. The healthcare system is not perfect. They make mistakes too. Information gets lost. People don't follow through. Pre-approvals for treatments can be delayed or denied. Whatever you do, keep going. Get the information you need. Take the time to evaluate. Be thorough. Be positive so that you can avoid this decisional regret about not doing enough or looking back and saying, oh, I wish I made a different decision. So as you go through this process, think about the decisions that you make, even everyday decisions, right? Like, I'm going to drive this way to work today, and that was a good idea because there was an accident over there, right? Or I'm going to make this for dinner, or, my kids have to choose between soccer and baseball, right? Think about the decisions that you make after deciding. And the goal is to have a positive response so that you can say, wow, that was the right decision. I would go for the same choice if I had to do this all over again. That decision, wow, I didn't realize how smart I was when I did that. That's what you want to come out with. What you don't want to come out with is, oh, I so regret this choice because of X. Or, oh, that choice, it did a lot of harm, it did a lot of damage, caused a lot of problems because of Y. That's what you don't want to say to yourself. So do the best that you can. Go through these 10 habits again. Seek, find the help, get the information you need to make the best care and patient decisions that you possibly can. I thank you for being here. I'm Pamela D Wilson. I'm a caregiving expert, advocate, and speaker. Been doing this for more than 20 years. Please do like this video, follow my YouTube channel, comment on these videos, even if it's only to say a simple thank you. That allows other people to more easily find these videos. Your participation makes it easier for other people to find these videos. Also, go to my website, PamelaDWilson.com. A lot of helpful information and tips there. I have a caregiving group on Facebook. It is called the Caregiving Trap. You can request to join. Thousands of great people there. I also have a podcast called The Caring Generation. I look forward to seeing you all again soon. I'm sending you lots of hope, positive thoughts, and healing thoughts. I'll see you again soon in another video.